Women planning on giving birth have to go for antenatal care, which requires that one gets tested for HIV, so that if she's found positive, interventions to save the baby can be made. About 4 years ago, Specioza Mukampamira discovered her HIV status.
My first test was in the village. I took another one in town. I was then started on the medication.
The two men who fathered her first two children have long passed on. The children are 19 and 10 years old. The father of a 6-year-old still lives, but not with her. The 3 children do not have HIV. The father to her 3.5-year-old is also alive, but he too does not live with her. She suspects he transmitted the virus to her. Her child is also infected. She refused all attempts to cover her face before the camera, saying she has nothing to hide.
Even if I didn't go to school, I knew that I had to have a test. I'm glad I tested. I don't fear this disease. I just worry about my children.
She has another partner now, and she's pregnant with his child, close to 2 months old. Does he know that you have HIV?
I haven't told him yet, and if I tell him, he will fear me.
Specioza's fear is shared by this woman and many others. The nurse tries hard to persuade her to tell her partner about her positive status. Florence Buluba, the executive director of National Association of Women Living with HIV in Uganda, says this is common.
A woman has become a victim in that she's the one to test first. She knows her status first, and on disclosing it to her partner, the end result is either beating. She's labeled the one who has brought the virus in the home.
Specioza's greatest fear is her partner throwing her out, and that is why she has not yet revealed her HIV status to him.
I am only looking for help. I don't want to kill him. I am not wicked. My heart pushes me into telling him to start on the medication with me.
She wants to make things right, and that is why she gave the health workers her partner's number, but they have never called him.
I want him to come with me to the hospital so that we get the news together.
Statistics reveal that, in Uganda, only a few men go with their spouses to health facilities. It is all becoming a bit much for Specioza, who says she just might give up the struggle to keep her 3 older children in school. Financial security is the main reason that Specioza gives for not telling her newly found partner that she has HIV. However, as much as she fears that she has spread the virus to him, she's wise enough to realize that she needs to come to the hospital to get treatment in time so that her baby gets delivered when he's HIV-free.
She's already enrolled in the art clinic, so it was just by mistake that somebody who saw her on 8th didn't start her. But ideally, these days what we do, you test positive today, you are very sure that you are pregnant, you are HIV positive, we initiate you on option B+ there and then.
This is a new policy guideline by WHO implemented by the Minister of Health in the country. Regardless of a woman's CD4 count, she has to be started on AAA ARVs for life immediately after diagnosis. Her last born was enrolled on ART, but has however been without drugs for weeks now.
I didn't bring him, and I also suffer to get here. I come from an island. I pay water and road transport, and sometimes I have to walk.
Unfortunately, she cannot take ARVs for her child. The current policy does not permit it.
We encourage that the people coming to get the medicine must come in person so that they can be examined. If there is any reaction to the drugs, it can be checked.
We requested that maybe possible ways of having the drugs moved nearer to the people who are in far-to-reach areas could be made to make sure that people don't default on treatment. And defaulting also has another consequence, that you become resistant and the drugs no longer work.
The Ministry of Health has mostly accredited upper health facilities to give ARVs, yet in some places, for example where Specioza comes from, an island, there are low-level health centers. Specioza has been told she's hypertensive and she's to come back when there are enough drugs. She also has to go home with hypertensive tablets for a month. At the drug shop, she discovers they cost more than the money in her purse, 6,000 shillings, about $3. This enrolled nurse persuades her to buy in shifts, but she adamantly says she would rather go without.
How about those who come from Panau like her?
They send friends.
There is the worry that the new trend in HIV is that it is moving from the rich women to the poor.
If a woman is empowered economically, she can be able to have a quality life, she can fight for her rights, and she can be able to get treatment and to take care of her children.
This is all a dream for Specioza, who knows it can only be fulfilled through her new partner.
I am not yet sure about his giving, since I've only been with him for 2 months.
His chances of being HIV negative are still high, considering the fact that she has been taking her drugs for long. The more she delays to tell him of her status, the higher the chances of him getting infected. But like she says, she needs food on the table and an education for her children. Florence Alimba, NTV in PG District.